Hi, my name is Ananda and I am a nursing student at UNC Pembroke. Today I will be teaching the proper nutrition for pregnant women throughout the 3 trimesters. My objectives for this video are to teach the nutritional needs for the different trimesters so you can understand why you need those nutrients. Also, how to use nutrition to combat common diseases and conditions that develop throughout pregnancy. And also I will try to provide a sample my plate to help give a visualization to what a plate should look like for a pregnant woman. So for the first trimester, it's really important, well, all the trimesters actually, but it's especially important in the first trimester to make sure you're having a well-balanced diet and avoid harmful substances such as alcohol and over-the-counter drugs, prescription drugs, contraindicated drugs, because the placenta is forming during this stage, and the placenta is connected to the embryo or fetus, and their major organs are forming the first 2 to 3 months after conception. So those required nutrients that the baby needs to form those organs are coming from the mother's diet and her body stores. So for ages 19 to 50 years old, the recommended daily allowance for nutrients are 1,000 milligrams for calcium, 3 milligrams for fluoride, 220 milligrams for iodine, 27 milligrams for iron, 11 milligrams for zinc, 175 grams for carbohydrates, and 71 grams for protein. The recommended vitamins for that same age group are vitamin A, you need 770 micrograms, vitamin C, you need 85 milligrams, vitamin D, you need 15 micrograms, vitamin E, you need 15 milligrams, thiamine, you need 1.4 milligrams, niacin, 18 milligrams, vitamin B6, 1.9 milligrams, folate, 600 micrograms, vitamin B12, 2.6 micrograms. And as mentioned before, there are substances you should avoid while you are pregnant. Alcohol is one major thing you want to avoid. It readily crosses the placenta, and the fetus has inadequate enzymes to detoxify alcohol like an adult has, and that puts the baby at risk for fetal alcohol syndrome. You also want to avoid soft cheeses and ready-to-eat meats. They are associated with outbreaks of listeriosis, which is a bacterial foodborne illness caused by Listeria monocytogenes, which is usually mild in the mother but can result in spontaneous abortion, premature delivery, stillbirth, neonatal meningitis, and septicemia in the fetus. Certain species and amounts of fish can be a major source of mercury, which in high levels can be harmful to fetal brain development. Also, you want to make sure you avoid undercooked meat and unwashed produce. Not practicing food hygiene can lead to an infection with Toxoplasma gondii, which is a harmful parasite that causes an estimated 400 to 4,000 cases of toxoplasmosis annually, producing mental retardation, blindness, and epilepsy. During the second trimester, you will need to have an extra 340 kilograms per day, because as the baby is getting bigger, you should be eating more to provide extra nutrients for that baby. During the third trimester, for the same reason, you want to consume an extra 452 kilocalories per day on average. And we are going to next talk about common conditions that develop throughout pregnancy. So one condition that a lot of pregnant women get is pica. Pica is a compulsive ingestion of non-food items, usually dirt, clay, laundry starch, baking soda, or ice. Physiologic causes for this are a deficiency in certain vitamins such as zinc, iron, calcium, thiamine, and vitamin C. So conditions that are complications of pregnancy are gestational diabetes. Gestational diabetes is when the woman that is pregnant gets high blood glucose in the second and third trimester, and she doesn't normally have diabetes. This can be treated with proper diet, but if the proper diet is ineffective for her, she can get insulin and use that for her medication. Another condition that is a complication of pregnancy is hyperemesis gravidium. This is a condition where there's severe nausea and vomiting after the 14th week of pregnancy. It can lead to severe dehydration and electrolyte imbalance, obviously because they're constantly having more output than input into the body. The approaches to treat hyperemesis gravidium are consuming products with ginger in it. That's why a lot of women try to drink like ginger ale or eat foods with ginger in it. Rehydrating, so that means drinking more water, more drinks with electrolytes in it, and also consuming antiemetics, which they can be prescribed by their doctor. And there are certain cases where women can have corticosteroid therapy to treat it. So a sample meal plan for a pregnant woman looks a lot like this. Okay, you would like to have 2.5 to 3 cups of vegetables a day, 1.5 to 2 cups of fruits a day, 6 to 8 ounces of carbohydrates or grains a day, and 5 to 6 ounces of protein a day. And you also would like to have 2 to 3 cups of dairy in addition to the 8 cups of water you should already be drinking a day, or maybe even more since you're pregnant. You want to cook food in healthy oils such as olive and canola oil. And you want to be consuming nuts, seeds, and avocados or other foods that contain healthy fats. And also, it is good for you to aim for 30 minutes of physical activity a day, because even though you're pregnant, you should still be active for your baby and engaging in healthy activities. It's not good to be sedentary unless you're on bed rest. I think that covers everything I want to tell you. The last thing I want to say is that I will be leaving a link at the end of this video where you can put in your height, your weight, just different things about you, so you can create your own plate on choosemyplate.gov. And that is all. Thank you.